Depression is diagnosed in close to 4% of the world's population and roughly 8% of the population in America alone. Sadness is common to all of humankind, although experiencing a depressed mood is different than being diagnosed with major depression. First, let's explore the difference between sadness and major depression, and then talk about some of the reasons why a person might enter into a major depressive episode. Everyone has felt sad at some point in their lives. This is completely normal. A temporary feeling of sadness is not considered to be a sign of major depression. However, experiencing prolonged sadness for at least 2 weeks can be a cause for further investigation. The most common diagnosis for individuals with depression is major depression. Major depression typically appears as an individual experiencing persistent feelings of sadness, or emptiness, hopelessness, irritability or restlessness, loss of interest in hobbies, lowered energy, concentration difficulties, appetite changes such as eating more or less than usual, and thoughts of wanting to harm oneself. The difference between a depressed mood and depression is that depression is typically longer lasting and not necessarily attached to any obvious cause. Now, let's look at risk factors for entering into a depressive episode. Risk factors, according to a 2009 report by the Institute of Medicine, include people who are related to you having a diagnosis of major depression, poverty, exposure to abuse in childhood, and maladaptive behavioral patterns or cognitive styles. Maladaptive behaviors include those that the individual engages in that create or maintain a depressed mood. Persistent negative self-talk, cognitive distortions, and automatic negative thoughts all lie in the category of cognitive styles. Self-talk has to do with the things one says to themselves. Cognitive distortions can appear in the way one interprets a situation or the world, such as discounting the positives, mind reading, catastrophizing, and making judgments about ourselves, others, and the world. Automatic negative thoughts are those thoughts that seem to intrude and disrupt one's state of mind in a stressful situation, such as when someone says something harmful to you and you automatically think I am useless. Poverty and exposure to abuse or violence in childhood are also risk factors for a diagnosis of major depression. It must be said that human beings are highly resilient, and many of those who suffer with depressive moods have endured suffering that many wouldn't be able to comprehend. It is because of this resilience that this channel has hope that one can manage and even heal their illness, and their situation need not be hopeless. Mental health resources are not easily accessible for everyone. Issues with cost, time constraints, lack of knowledge of options, and accessibility issues can all prevent an individual from attaining the help that they need. Therefore, this channel aims to make scientific knowledge on mental health easily accessible for the general populace.